I'm an endoscopist based in Shenyang, China, and currently serve as editor-in-chief of Endoscopic Ultrasound journal. In addition to my clinical work, I hold several leadership roles in academic and medical societies. I'm a vice president of China Medical University. On the professional society front, I serve as vice president of China Society of Digestive Endoscopy, vice chairman of China Society of Gastroenterologists and Hepatologists, and vice chairman of China Society of Endoscopists. The focus of my research is endoscopic therapy, especially minimally invasive techniques under U.S. guidance. As one of the pioneers on U.S. interventional techniques in Eastern, reported the first study series on U.S.-guided interstitial brachytherapy, U.S.-guided goblet drainage, cholecystoid lithotomy, and so on. In current years, I mainly engaged in research and development of endoscopic ultrasound equipment and related instruments such as LAMS stents and special puncture needles, as well as organoid techniques based on US. As the editor-in-chief of U.S. Journal, I would expect the field to undergo transformative change over the next decades, driven by technological innovation, clinical demands, and collaborative research. Several key drivers will celebrate this transformation. The first, artificial intelligence and automation. AI will revolutionize US. Machine learning models trained on the large data size will enhance the imaging interpretation, reduce the operator dependency, and support clinical decision-making, making high-quality US more accessible worldwide. The second, minimally invasive therapeutic innovation. US-guided interventions such as drainage, biopsy, targeted tumor ablation, and local drug delivery will be further expanded and widely accepted. This progress will be driven by demand for less invasive treatment and improved patient outcomes, positioning US at the forefront of interventional gastroenterology. The third, multi-omics and precision medicine. US will serve as a critical gateway for obtaining tissues and fluid samples for genomic, proteomics, and multi-bolomic analysis. Integrating these multi-omics data with imaging findings will allow tailored therapeutic strategies, transforming how we manage diseases like pancreatic cancer and clinical pancreatitis. For example, back in 2020, we published a prospective trial to determine the optimal number of US-guided fine needle passes required for successful organoid creation in pancreatic ductal adenocarcinoma. In the future, it will profoundly change the diagnosis and the treatment mode of malignant tumor from the traditional treatment based on population statistics to treatment based on individual model verification, which will greatly promote the precision medicine from concept to reality. As the official journal of multi-international endoscopy societies, U.S. is committed to facilitating these advances by publishing pioneering research, fostering interdisciplinary dialogues, and promoting standards that support the next decades of progress. U.S. is a relatively new and rapidly developing discipline. All relevant journals, such as GIE and endoscopy, belong to endoscopy. But our US does not only belong to endoscopy, but more importantly belongs to ultrasound. Also, US is an interdisciplinary science. Some US procedures are performed by multidisciplinary teams, which include gastroenterologists, sonographers, cytologists on site for US fine needle aspiration, and pathologists for confocal endomicroscopy. First, of course, sonographers need a platform to communicate and publish their research findings. Since 1982, 14,587 articles scattered between 1,480 journals have been published. None of the journals are dedicated U.S. journals. During the past decades, there are more than 500 to 600 articles on U.S. in SCI database every year. A significant amount of research in U.S. is not accepted, sometimes because of quality issues. However, more often than not, the journal have to primarily serve the legitimate needs of their own subjects and societies. 28% is the upper limit of articles published. Therefore, some valuable research findings and experiences does not get the opportunity to be shared and communicated globally. So the answer to the question is our own journal focused on US. As the editor-in-chief, I envision our journal as the leading platform for cutting-edge clinical relevant research that advances the field of US and its related disciplines. In addition, it should be noted that since US is an interdisciplinary science, this field, so as the journal, serve not only the gastroenterologist, endoscopist, surgeons, and pulmonologists, but also the endocrinologists, urologists, gynecologists, pediatrics, pathologists, and biomedical engineering. Our publications should cover above the disciplines. We are particularly interested in publishing high-quality work that falls into the following categories: innovative techniques and procedures, study introducing novel techniques, devices, procedural advancements that enhance the accuracy, safety, efficiency of US. Translation and clinical research. Robust clinical trials, large-scale multi-center studies, and outcomes research that bridge the gap between scientific innovation and everyday clinical practice. Early diagnosis and therapeutics. Research focused on diagnostic and therapeutic application of US, especially in oncology and pancreatology, including fine needle aspiration, biopsy techniques, and emerging therapeutic innovations. Imaging technology and AI. Developments in imaging processing, artificial intelligence, and computer-aided diagnosis that improved imaging interpretation and diagnostic yield, review articles and consensus guidelines, comprehensive reviews, and evidence-based guidelines authored by leading experts that help shape standards and future directions in the field. We welcome submissions from research and endoscopists worldwide that demonstrate scientific rigor, originality, and potential to influence practice and inspire future innovation. Premier platform in niche field. US is one of the new journals dedicated exclusively to science and practice of endoscopic ultrasound, high visibility and global reach. As an open access journal, all published articles are immediately and permanently free to read, download, and share worldwide. High impact and prestige ranking. The journal's quality and influence are consistently validated by leading indexing bodies, including PubMed, ICIE, Scopus, AppScore, Embase, CNKI, and Google Scholar. Endoscopic Ultrasound holds a Q1 ranking in journal citation reports, category of gastroenterologist and hepatology, with the latest 5 years impact factor around 4.4 to 5.6. Furthermore, in Chinese Academy Sciences ranking system, is recognized as the Zoom 1 top journal, the highest tier of academic excellence. This demonstrates that publishing in US offers a significant impact for career advancement, both internationally and within China. US is proud to be officially endorsed journal of multi-leading international and regional societies, including the International Society of US, the European US Scientific Committee, the Asia Pacific US Task Force, and the Latin American Society of US. This unique position makes US central forum for global US community. In short, we offer authors a unique combination of specialized prestigious and global open access dissemination. We invite the researchers to join us in shaping the future of endoscopic ultrasound.